SuPAR is a biomarker that can say something about your general well-being.
And we use it to determine, are the patients really sick? Should we really focus our attention on it? Or is SuPAR low and maybe we can send the patients home?
BlueSense Diagnostics is a small startup company that came out of my research group.
We do point-of-care diagnostics for human applications.
It's based on a DVD technology, as we call it. So it's a rotating disc, just the same size and shape as a normal DVD.
We work on inflammation diagnostics and infection diagnostics together with Hvidovre Hospital and Virogates, so utilizing their biomarker SuPAR.
So here you have two companies, BlueSense spun out of DTU and Virogates, which is spun out of Hvidovre Hospital. And they now collaborate with the hospitals and DTU to put these biomarkers that we have developed in this clinical setting onto their technology, microfluidic nanotech platform.
I mean, the benefit for the patient if you use the disc platform in combination with the SuPAR biomarker is that you can do really rapid diagnostics, or you can at least do very rapid testing whether you have something that needs to be dealt with.
We take a drop of blood from your finger, 5 to 10 microliters, you put it inside the machine, you wait for 7 minutes and you get your results.
So it gives the doctor an extra tool to help the patient and making better clinical decisions.
So the funding we got for this project is from an ERC Advanced grant and then from a Danish strategic research grant. And I mean, without that we would never have initiated this research direction, and we would never have initiated the collaboration. So it's crucial. It would never have started if we hadn't received this type of funding.
I would say that's probably the ERC POC project that we got was really the turning point for us in moving in starting to move away from the academia into a commercial aspect.
We have a dream that it will be very cheap, and we work towards that it has to be accessible. I mean, the technology is really using very cheap elements, because that's the way you get it out there also. You are in competition with other companies with regard with some of the markers, and they are already cheap, but they are too sophisticated to measure many times. So we make it as cheap or even cheaper, and we make it here and now, point of care.